Hello everyone, my name is Jen Nolan and I'd like to warmly welcome you to Move Muscle, Bone and Joint Health's webinar for community members. Today's webinar is on the importance of physical activity for muscle, bone and joint health. We are hoping to do another webinar for community members later in the year about managing pain and fatigue, and we'll be in touch with you with further details about that. Our presenter for today is Ms. Carolyn Page. Carolyn is a senior physiotherapist at St Vincent's Hospital in Melbourne and has over 20 years of experience. Carolyn also undertakes other key projects and was recently involved in leading the development of the model of care for osteoarthritis of the hip and knee. Without further ado, I'll hand proceedings over to Carolyn. Thanks very much, Carolyn.
Thank you, Jen, and thank you for the invitation to be able to present such an important subject today. The topic I am going to present today is around the importance of physical activity, and in particular for our muscle, bone and joints. It is interesting actually because it wasn't long ago when certain conditions were told to go home and rest. It was only approximately 10 years ago, if you came in with low back pain to a general practitioner, that their main advice was to go home and rest. Now that has changed dramatically over the last couple of years, and even more recently with Fitbits and gadgets to count steps, physical activity has become certainly an important aspect of all our lives. Physical activity, yes, there we go. Sorry about that. Physical activity can be defined as any movement of the body that uses energy. So it's a very broad area, and we'll talk and we'll hopefully through this presentation today, we'll get a bit more of an understanding what we actually mean by that. But generally, looking at the overall benefits of physical activity, we can see that they are enormous. And just to touch on a few general benefits on this slide, we can see that it helps to control weight. It's good for general health. It improves mood. It boosts energy. It's better for sleeping, and it can be fun and social. And importantly, these benefits can be immediate. I guess too often we're told with diets and things that it takes time for these things to take effect. But certainly with physical activity, the results can be immediate. And with continued efforts in physical activity, these effects can be long-term. I guess we shouldn't also think about, although today's presentation is around physical activity, there are two, and particularly one main key other component that is normally grouped together when we discuss the benefits of physical activity, and that's usually around diet, that healthy eating patterns are really important and go hand in hand with physical activity. And education and advice and knowledge, particularly around any core diseases or problems people have, is really important. And these three key components are very important to overall consider together. But our main topic today of discussion is around physical activity. And this can be brought down into two main sections, and that is around prevention and management. So prevention of diseases and how physical activity can provide the benefit to prevent these diseases coming on. So largely the diseases that we're defining today are things what we call chronic diseases. Back in the post-war periods, that type of era, chronic disease wasn't a very big part of our community. It was more about acute broken bones, acute infections that largely were the main core area of our health management. With the aging population and a variety of other things such as obesity and lack of physical activity, these more chronic diseases have become a big problem in our community. And so prevention of these diseases is a really core factor. So looking at things like osteoporosis, arthritis, and muscle pathologies, as well as cardiovascular heart problems, diabetes, and particularly type 2 diabetes, and tumours. And we know from studies that physical activity could prevent 3 million of these deaths around the world each year. And the earlier we start with physical activity, such as in childhood, the more impact it will have on preventing these diseases. When we look at studies that actually support these claims, it's okay to flash them on the screen or read them in the newspaper, but when we actually look at really good studies that actually support these statements, they are actually quite large. And in diabetes, there's a number of studies that says that if you actually have early risk factors, so your bloods are starting to become a little bit increased, and the GP might say to you that you're at risk of developing diabetes. We know that these studies show us that with physical activity, you can reduce the risk of developing diabetes, and it can help to control your blood sugars. In cancers, there's a number of studies for a variety of cancers around the body, both in men and in women, that physical activity can reduce the risk of developing these cancers. And the evidence is the highest in breast cancer and colon cancer. Arthritis, particularly around osteoarthritis, so the disease that affects particularly big, large joints of the bodies, often referred to as wear and tear disease, although that is not quite the correct definition these days. But that type of arthritis, physical activity is shown to be one of the key modifiable risk factors for development of osteoarthritis. When we look at the studies with cardiovascular disease, physical activity has shown to reduce heart attacks and strokes in many people around the world and in Australia. Osteoporosis, so where you've got less bone stock and density, physical activity can prevent the development of osteoporosis. So we can see on a snapshot that there's a lot of big studies in Australia and around the world supporting that physical activity can prevent the development or getting these diseases. It's not the only factor, but it can actually be one factor that we can address in trying to prevent these diseases coming on. But how much physical activity is enough? It's okay to say that physical activity can improve that, but often patients will then turn around to the GP or their practitioners and say, well, what do I have to do? How much physical activity is enough? And there are Australian physical activity guidelines. The government has pulled that question together and put a committee together and looked at all the evidence and have come up with some key statements. Now, these activity guidelines can be looked at on the web under the Australian government. And I've just summarised the key things that have come out of that big statement. And that is, doing any physical activity is better than doing none. You need to try to be active on most days, preferably all days every week. And when we look at the amount of physical activity, they suggest that 2.5 to 5 hours of moderate intensity or 1.25 to 2.5 hours of vigorous intensity each week is ideal. Be active on most days of the week. It's so important I put that in twice, but that I think is a very key statement. One of those activities should actually include a strengthening program, and if possible at least twice a week. And we need to minimise the amount of prolonged sitting. And I think the incidental exercise can't be overestimated in this situation. So that what I mean by that is that if you're going to the shopping centre and you always park quite close to the shops, try and park further away so that you're actually already doing that activity, you're going to the shops, but you're just making an effort to actually put more exercise into the things that you normally do. So if you normally get someone to go and pick up the paper for you or get your paper delivered, walking to the shop to get it. So those type of things can minimize the amount of prolonged sitting, and it can increase the amount of activity that you do on most days of the week. It is interesting, though, a lot of people with a variety of different conditions cannot actually achieve a lot of those aims because they're actually quite significant, 2.5 to 5 hours of moderate intensity exercise each week. That is quite hard, and if someone has got a condition such as back pain, osteoporosis, rheumatoid arthritis, those things can actually be quite difficult to achieve. And evidence that it's coming out now, I need to go back in a little minute. Evidence that it's coming out now demonstrates that any type of exercise is actually better than doing none. So that even small amounts of exercise is actually showing achievable aims. And that's really important. And they've done a study even in diabetes using some strength training. So just doing a little bit of weightlifting, whether it be just with a bit of a band or some weights, has actually showed to have positive benefits on glucose levels. So sometimes a small amount of exercise can still produce quite some substantial gains. There are other studies that have also showed that the people that are mostly deconditioned, so patients that or clients that actually are the weakest, are the most affected and can do the smallest amount of exercise. It's these patients sometimes that actually have the biggest gains to make with even the smallest amount of exercise. So I guess the message I'm really trying to say here is that it doesn't matter at what level that someone's at, whether they are wheelchair bound, can only walk to the door, or actually are playing golf 3 days a week. There's always something that actually can be achievable and something that can actually be of benefit to them, particularly around the prevention of disease. And the other thing is that there's been a number of studies that show that the more physical activity someone does, the more risk of decreased developing of the diseases. So it actually is like a seesaw. Sorry, I did have a slide, but it seems to have slipped off. But that it's a seesaw. So as you increase the physical activity, it decreases the risk of getting any diseases, particularly the chronic diseases like I explained before. The next area that I was going to touch on was in regards to management. So this is an area that if you already have the disease, so if you already have diabetes or osteoarthritis or low back pain, if you already have these conditions like cardiovascular, you've already got some hypertension, can physical activity do anything for you? And the answer is clearly yes. And for all these conditions, it certainly can be a big benefit. And looking at the evidence and the studies in patients that have got these conditions, it's quite soundly that they can improve these conditions quite resoundingly. So that's an important message to consider. How does actually it do that? That's actually a question that I tend to get asked as well. So it's great, you're telling me that it does, but how does it do it? And this is not going to be a science lecture, but I thought I would just quickly just give you some examples of what some evidence is showing that why physical activity does have a big benefit to us when we have got known diseases, and that is that it changes our body shape and what we're made of. So we have less fat tissue, and there's a lot of evidence around what fat tissue and what's made up in fat tissue and the effect that does have on our body. It reduces our cholesterol, which has a big impact on our blood flow. It improves glucose balance. It improves blood vessel condition, so our blood and the condition of our vessels. It improves our mental health, such as stress. It reduces the inflammation cells, particularly in the blood, and therefore the inflammation cells that are transported around our body and into our joints. It improves blood flow to the heart and improves blood pressure. It also improves the strength and the stability around joints and therefore decreases the load around joints. It increases the amount of bone tissue that is produced and hence reduces the risk of osteoporosis and improvement in osteoporosis. So you can see these are some of the studies and evidence to show why physical activity is good for us and good for us to prevent diseases, but not only that, it helps manage the disease once we have a known condition. So that's all interesting, and you might be saying, okay, well, I've sold on that message. I should be going out there doing something. But where do I start and what do I do? So I thought that was an important part of this webinar to just go through some of the things that you might like to consider in doing or starting some physical activity. And physical activity is quite a broad area, and probably this is a good point to say that there's, I guess, when we talk about physical activity or exercise, it is broadly classified in two separate areas, and one is if a general exercise program that is suitable for a large amount of people. It's not specifically designed for you or your condition itself, and so that's important to know, and we'll talk about that when we talk about different types of exercise. The other one is it's more of a therapeutic exercise. You might go to a professional, they've assessed you and they've given you specific exercises to your needs. They both come under physical activity, it's important to note that, but one is more of a guided professional management of your condition and one is a general exercise program. So either of those two things can still be included into these types of exercise. And individual exercises are ones that you just do on your own. And these can be done at home. And it's flexible. You can do them when you like. You often need to be a bit motivated to do it by yourself, and that can sometimes be a challenge. Sometimes written diaries or having the exercises written out for you and that you tick off each day can sometimes be a motivating strategy. Often there's limited equipment at home, but as I said before, you often don't need huge amounts of equipment to actually do and improve your physical activity. But often there's limited guidance. So this is a little bit of a problem if you're finding that that when you start an exercise program, you get pain. At those sort of times that guidance may be required. This is an area that may change actually over the next few years. There's a lot of telehealth programs, and I know at St Vincent's Hospital we're involved in two fairly major trials at the moment, looking at the ways of physiotherapy and in particular exercise can be delivered to people's homes. So you can be at home doing an exercise and have a physiotherapist with over an iPad or your computer or even your smartphone watch and look and guide you through an exercise program. So I guess that's a space to watch and hopefully that will also improve people's ability and flexibility to be able to exercise. The other area is like a group exercise program, and group exercises are often set times and venues. They can cost money both to get to that venue and to actually undertake the class. And there's a variety of options with exercise groups. You can do gym classes, you can do hydrotherapy, you can do just sitting down and chair-based exercises, and they can be at a gym doing a fairly high-level spin class on a bicycle. So they are a variety of options and levels of difficulty that people can employ in this area. The social contact in regards to these classes can be very important, and often classes for a specific disease pathology such as osteoarthritis, diabetes or heart problems. Sometimes those classes also introduce an education component on that disease, which if you remember back into one of my early slides, I said that was a very core component to improving the overall condition of someone. And Also, the motivating component of a class can be important as well. And often classes can have instruction. So a class can actually be a professional run class through a physiotherapist or exercise physiologist with individual programs still in a group situation, or a class can be like a local gym that an aerobics type instructor might just be performing a general exercise program and everyone following. So they all have their pros and cons, and it's certainly not one recipe fits all. And I think that's the important message to also give it to everyone today. I thought I'd just also talk about water exercises because it's a question I get asked a lot. And people probably group this under one area. You know, people might define swimming as a group of these or hydro as all these as well. So I thought I'd just go through that very quickly. And certainly they're all very good forms of physical activity or exercise. Swimming is a very, obviously, a pretty clear one to understand, but just to be reminded of the fact that different distances, different strokes are all provide different levels of exercise ability. Hydrotherapy is usually a word, and it's now often referred to as aquatic therapy, is usually run by a professional, often a physiotherapist, and that's usually targeted very specifically at somebody's pathology or condition or your problem yourself, and you usually have an individual or your own program designed for you in that class. As opposed to a group class, you may have seen at some of the local pools, there's usually like an aerobics instructor out the front with music and everyone follows suit. Again, there's not one of those that are any better than the other. It really depends on someone's needs and what they really like to do. A walking program is something that is usually talked about in all areas and all conditions. And I think we can underestimate the value of something so simple and cheap as walking. You do need to consider things such as slopes and steps and distance. For example, someone with low back pain, someone with back pain, particularly some of the conditions around back pain, slopes and steps can be very challenging and cause a lot more pain. And they might be something that needs to be avoided. So we just need to consider with walking, there's still within the walking a very different levels and different types of walking that people can do to match what they need and what their condition requires. I think the important thing here is that it needs to be a gradual increase in time and distance over time, so that somebody can improve and increase their physical activity. And that's where something like a pedometer or a Fitbit can be really useful to measure the improvement on a day-to-day level. I'll also mention here that walking with a gait aid or a stick or a crutch sometimes isn't bad, and I think that people have in our community the feeling that walking with a stick is a bad thing. It shows you're getting old and you're not coping very well. But actually, I find I'm often encouraging people to use a stick, not just because of their own safety for falling at times, but often it means that they can actually walk for a greater length of time. So if they don't use a stick and get pain and can only walk for 5 minutes, but with a stick they can walk quite easily for 15 or 30 minutes, they're going to have much better gains with their physical activity, increase their heart rate, and all those good things that we talked about earlier on can be real benefit by just using a stick. So that's an important message to take on board. So I'll just summarise at this point the golden rules that I came up with for starting off a program, and that is always start on something achievable. This may seem very small at the beginning and seem like you're not doing very much, but you need to start somewhere. Starting off too hard, too much, it's basically a boom and bust theory. People stop doing it and don't continue. I work in a fairly busy osteoarthritis clinic, and every week I would have people coming in saying to me that they've started an exercise program, that they thought it was good, maybe with a physio, an exercise physiologist, and it was made them too sore, so they didn't go back. I would hear that every week. And I think it's probably a fault sometimes of professionals that they have this whole hour or half an hour with a patient. They want to get the most out of it for that half an hour, but they just do too much. So I think that message of starting on something achievable is really important, and something simple, and then increase it. The increasing bit is important, though, because you're only going to have further gains in all those things that we discussed if you slowly increase the level that you can do. I think it is important to work out what interests you, because you're more likely to continue it. If you really hate being in water, you're not going to love doing hydrotherapy. So doing something that interests you is really important. As with anything, starting today and not putting it off, again, is an important message. And mix up the type of exercise. As the guidelines state, some of our exercises should include some strengthening programs, as well as a general fitness or walking program. And congratulate yourself. I always try to tell patients, to take a photo of themselves walking, or just jot down what they can achieve. Look back into it in 6 weeks' time and see where you've come, because I think that's a very important thing to see that you're actually making improvements for all the effort you're putting on. So where do you go? So where, some of the facilities or funding opportunities that are around at the moment, and there might be many, many more because it keeps changing. There's a range of professionals, both private and public, that can help you, start you off, and if you need any individual exercise programs to actually achieve that. A lot of the community health centres run a lot of group programs and individual programs. And if you're over the age of 65, often going through My Aged Care at the moment can be helpful in helping direct you to the most important area or closest area for you. There are Medicare-funded private services such as physiotherapy and exercise physiologists and hydrotherapy for chronic diseases, which are the diseases I talked about before. And your general practitioner can help coordinate that for you. Look, it's probably not perfect for a long-term solution, but it may just provide you with that initial assessment and encouragement and advice to start you off. Certainly you can, if you're feeling confident, to start your own activity like walking, bike, swimming, or going to the gym. And there's a lot of councils that have funded opportunities, and I know the City of Yarra in April had free YMCA gym memberships available for people residing in that community. So there are a lot of council opportunities, and it might be worth contacting your council to see what they offer as far as things. In the past, they've done Fabulous 50s and things like that, which have had some support funding-wise at local gyms for people to be involved in classes. And there are some specially funded classes for diabetes, cardiovascular, and some specific other exercises that are run by hospitals and community health centres for people with those sort of conditions. There's also resources available for education and also advice on exercise and physical activity with certain conditions. And this is an example of a website called Better Health Channel, which is a government website. And I don't seem to be able to go forward in my slides. Oh, there we go. So that Better Health Channel is a government channel, so that's worth looking at as well. And, we're going a bit too fast through our slides. Never mind, we're just about finished anyway. The last one we fleshed through was Muscle, Bone and Joint Health. And they've got a fantastic helpline and also actually quite a number of resources, and one such as this and a number of other consumer advice sheets on a variety of different conditions and suggestions of physical activity. So I hope that today provided you with a bit of an overview on on physical activity, some of the evidence and studies and things like that have been doing over the last few years to actually really show you that it actually is fantastic and important part of our everyday life. So I hope you enjoyed that. Thank you.
Thanks very much, Carolyn. That was a very clear and comprehensive presentation that was really very informative, and I think the great part was that you gave people good food for thought. You've certainly given me some food for thought about starting today and not leaving it till tomorrow. We've actually had a few questions coming through, which are fabulous. So if anyone else has any other questions that they would like to ask Carolyn, please type them in the chat box to the left of your screen now. The first question that came through, Carolyn, was from Carolyn, who asked about if the kind of physical activity in relation to can affect rheumatoid arthritis potentially getting worse.
Oh, I lost you a little bit. Can you hear me, Jen?
Yeah. So
yeah. I think the question was in regards to rheumatoid arthritis and getting worse with any particular physical activity. Actually, there's been quite a number of quite good studies done on rheumatoid arthritis, and actually the evidence is very much that physical activity does not make rheumatoid arthritis worse. And that study actually used quite moderate levels of exercise, probably a lot more than what would normally be given in the community. So, look, I certainly think high impact exercise like running, jogging, hopping, those type of exercises, we need to be a little bit mindful about the amount of force that are going through joints with rheumatoid arthritis. But certainly for a moderate level of activity, physical activity has shown to actually improve rheumatoid arthritis. As far as prevent rheumatoid arthritis, that certainly has not been shown. So there's no evidence to say that physical activity prevents rheumatoid arthritis. There's quite a lot of evidence at the moment coming through that smoking and being generally less well and fit does have some impact on the development of the disease. But certainly physical activity on its own, I don't think we can claim that has an impact on the development of rheumatoid arthritis.
Carolyn, the next question is from someone who talks about having fibromyalgia and mental illness and feels a bit discouraged that it's hard to actually continually increase the distance that she walks. So what sort of strategies you talked about, sort of starting small and trying to build up? Any suggestions there about how to build up exercise over a longer distance without experiencing the setbacks?
Yeah, no, it's a really good question, and sometimes, although I've sort of expanded walking today because it's a simple, cheap, and exercise that people can do easily, but sometimes it's not the only exercise, and it's certainly not always the best exercise for everyone. So, because sometimes, if somebody, for example, has got a sort of like what we would say like a poor biomechanic, so every time they walk they actually lean more heavily on one side, for example. If you do that over a period of longer distance, that can actually increase that load in that area. So sometimes just increasing distance for walking with some of those known areas might not be the key thing. So that's where I would try and move away from that and look at other ways. So maybe a stationary exercise bike might be better. Maybe hydrotherapy might be better. So I think the advice is if these are, it's very hard in a presentation to be individual about it and they're just broad sort of statements. I think that if anyone is having any trouble with any of those things, that seeking professional advice is always important. But I think it is important to note that there's always an activity that somebody can manage, whether it's very simple sitting in the chair, home exercises, lying on the bed exercises, and then gradually move on to developing of those. I don't know if that's quite answering your question, but I think it's important to note that it's not the only form of exercise. But starting small in saying that, and it might be for some people that you need to do a 5 or 10 minute walking program for 6 weeks before increasing it. But yes, otherwise I would certainly seek help. And certainly from, mental illness is an important one, because there's a lot of evidence to say that patients that do have mental health issues often are ones that don't have enough physical activity. And again, any physical activity can improve mental health as well. So there is a very, very strong link there. So I would certainly encourage anyone in that field to actually seek help or look into that field.
Carolyn, another question is about a delayed onset of muscle soreness. Jenny asked that if she exercises, she finds that 2 days later she gets some muscle soreness in her gluteal muscles, which puts her off doing more exercise. Should she accept that soreness is a good sign?
Look, that they are. Again, a really good question, and it's a question that comes up all the time. I think that comes about, look, there is a degree of muscle soreness that sometimes if you haven't done a new exercise, I know if I go and play tennis this afternoon, I would probably be quite sore over the next couple of days because I haven't played in 2 years, and I'm using different muscles and different strategies of muscles that I haven't used before. So if you're starting off a new exercise, I guess that's to be expected, as long as it's not too painful. And we often use a scale called a visual analog scale, and it's a pain scale out of 10, with 0 out of 10 being no pain and 10 out of 10 being quite a lot of pain, most pain that you could think that you could have. And so we often get patients to rate their pain on that scale. And if you've got pain like 5 out of 10, which would be a moderate level of pain, or we might say to you, well, look, we only want you to be able, when you're doing that exercise or even the recovery from the exercise, that pain should be no more than 3 out of 10. So it's less than what you would normally sort of experience. So and then slowly increase the activity, but leaving that same visual analog scale. And a lot of chronic pain clinics use that kind of model, and that's called pacing, gradually increasing your activity, but not setting your pain level at less than what you would normally want to experience. And that's really important, and you might need some help to achieve that. In saying the other answer to that question, if you're getting that same pain every single time, as opposed to when it's just a new exercise for you, might be a different situation as well. So there's not an easy answer to that, except to say that you probably need to see if you can just reduce that exercise and see if you can actually decrease that pain and keep that going, and then slowly, gradually increase it and see if you can get less of that muscle soreness. Because if you're doing that exercise repeatedly, quite commonly, you shouldn't really be having that same muscle soreness each time. That should slowly decrease. So otherwise, I would certainly get some assistance to help you move forward.
Carolyn, it seems as if we're having a little bit of trouble with the audio, and some people are having trouble hearing our question time. So I believe that Redback Support are working on that. So we might have one more question, and then we will. We can also get you to maybe sort of type some brief responses to the questions so that people can actually get the responses to the questions. One other question that came through was about just about exercise and how it can reduce the inflammation cells in the blood. Can you just say a little bit more about how exercise can reduce the inflammation cells in the blood flow?
Okay, and a lot of those things are not just one area. There can be quite multifactorial, being there's quite a number of reasons that decreases. And I guess it comes to the question of how the inflammatory cells get into the blood and what causes that. There is certainly some discussion on, for example, for the fat tissue. There's a lot of interest now in, there's some inflammatory tissue within the fat tissue, and that as you have better body composition, that you would have less inflammatory issues in regards to that. Also, just the fact that you're improving your blood flow through different areas can reduce the inflammation. And also that a lot of things are less under stress, so that if you've got a better healthy system, that you have less stress. Because, for example, the inflammatory cells for osteoarthritis are produced in the joint, and if the joint is not moving properly, you don't have the fluid in the joints moving as well through the joint, that can all have an effect on the inflammatory markers in your blood. So I guess it is actually quite technical as far as inflammation cells and where it all comes from, and that all has different impacts on different areas of your blood and system. So it is actually quite a complex area to discuss quite at length here today. But I'm happy to probably send you any references or things like that you can further look up if you like. Oh, sorry, Jen, I can't hear you very well.
We had a problem just with the beginning of question time. What we might do is maybe finish off shortly. I'm very sorry if people have experienced some the difficulty with the sound just during question time. When the recording of the webinar is sent out, you'll be able to hear Carolyn's responses to the questions. There was just one last comment in relation to, you made mention of a gait aid, and I see that Jenny has responded by sort of saying that she uses hiking poles when she walks around the city, and I must say Nordic walking poles did come to mind as a great way to sort of take the load off some of the joints when people are attempting to walk. And also, there's just a last comment from Amanda, who made that comment about not being able to walk very far, and she just sort of said that she's only walking past 2 houses and then back. But I guess you've got those other suggestions about other things that she may like to try. So look, we're very close to 1:45, so we might wrap it up there. Carolyn, thanks again for a very comprehensive presentation. As I've just said to everybody, if you are unable to hear Carolyn's responses to the questions, when you receive the recording, you'll be able to hear them then. I'd like to thank you all very much for joining in today, and we will be sending you further information about our next webinar in a couple of months, which will be about pain and the management of fatigue, and that will be with Fiona Thomas from the Caulfield Pain Clinic. And I would be very grateful if, when you receive the email this afternoon, that you give us your feedback about today's webinar, and I certainly hope that you will join us for our next webinar when we send you further information about that. So on that note, I'd like to thank you, Carolyn, and I'd like to thank everyone for joining us and bid you a very enjoyable afternoon. Thanks, everyone.
Thank you.
And goodbye.